Hello, I'm Dr. Elizabeth Coyne, and I'm a nurse and a researcher, and I work as a senior lecturer at Griffith University. And with me today, I have Karen Dieperink. And Karen, would you like to introduce yourself?
Yes, thank you, Dr. Coyne. I'm very pleased to be here. Actually, my name is Karen Dieperink and I'm from Denmark, where I work as a nurse and an associate professor at University of Southern Denmark. In my daily clinic, I meet patients with brain cancer and their families, and they often have trouble to sleep.
So today we're going to talk about sleep and the importance of sleep and give you some tips for better sleep. Because we know that many caregivers have trouble with sleep due to stress and the responsibility they carry every day. So
At
Karen,
this, yeah, at this first slide, you can see that we all need to sleep, but the needs vary according to the age we have. But of course, it's not all about the hours, but also about the quality of the sleep. And in my oncology clinic, I meet cancer patients, but also caregivers that can have difficulties getting to sleep, staying asleep, or they may experience poor sleep quality.
so why is it so important to sleep?
Well, we know that our brain needs to sleep. Trials have found relationship between insomnia and depression and anxiety, as well as a decreased immune functioning. Further, there's a risk of other medical disorders, as you can see at this slide, with overweight or obesity, high blood pressure, risk of heart diseases, or risk of diabetes. We need to sleep to be positive in our relationships. We need to sleep to communicate. Can you press the next?
Getting there.
Yes, to communicate and to solve problems and to react properly, to learn and to remember, and finally to have a good immune response. Insomnia itself can have a number of negative daytime consequences as fatigue and greater irritability, and as such, sleep affects our social relationships, and it can go into a negative circle like you see at this slide. And when you have caregiver responsibilities, it is very important, but not easy to take care of yourself to be able to care of your loved ones. So it's like they say in the planes, take the oxygen mask on before you put it on others. And here we have a long list of different things you can do to have a better sleep. And one of the things is to try to avoid caffeine before bedtime. Many of my patients are talking about not having coffee after 8 o'clock in the evening. Also to avoid alcohol before bedtime and to avoid large amounts of energy and high fat diet before bedtime. You have to be sure to be physically active during the day. Things you can do is to make meditative movement interventions like Tai Chi, Qigong, or yoga. It is shown to improve the sleep but also reduce depression and anxiety. There's a lot you can do about your bedroom. You can make sure that it's well tempered from 18 to 21 degrees. You can try to avoid noise, about 30 decibel in the bedroom, perhaps even use earplugs. Or if your husband or wife are snorkeling, you can sleep in another room. You can try to avoid light from the screens. This blue light is not good for you, coming from a computer, a tablet, or from TV. And you can make sure that the bedroom is dark, and you can even use masks over the eyes.
They sound like really great ideas, Karen, and
Yeah,
so important to look at, yet actually sort of fairly simple ideas that may have a big difference with your sleep quality.
mm. And we have a list, one more list, because you can also make sure to go to bed and get up at regular times, also in the weekends and in holidays. Our body is like, it works best like a clockwork. And you can try to avoid sleep during the day, even if you're sleepy, but it's okay to take a 20 minutes power nap. So only go to bed when you are sleepy and leave the bedroom if you cannot fall asleep. Then move into another room, read a book, or listen to music. You can learn some relaxation techniques. You can use it if you wake up at night or have difficulties falling asleep, and you can find these different music pieces for sleep medication in YouTube. Using this link, there's a lot of resources there. And then try not to pondering problems and tomorrow's activities while you're lying in bed. If you have some stuff to think of, as I know many of you have, then try to maybe write it on a block, a list between your bed, at your bed, and then it should be out of the system. Be aware of excessively negative thoughts about sleep that can help you keep you awake, because people with sleep problems often underestimate the number of hours they sleep. They actually sleep, but it can feel like you're not sleeping good. Yeah.
So by that, do you mean sort of don't worry that you're not getting enough sleep, but just focus on sort of that, trying to have sleep instead of being so concerned that you may not be getting enough sleep?
Yeah. The body is very, very nice, trying to make to have the sleep they want, the body wants. So it's very you can have a number of things to do to give you a better sleep, and try that, and don't give up although it's not working the first days.
Yeah, and sometimes it does take practice to actually develop that new routine for your sleep, doesn't it?
Yes, I know that many people are looking at the iPad before they sleep, and that's really not good. So
What
that's
if they
one thing.
had their book on an iPad, Karen? Does that make any difference? Can they change the light on the iPad?
Yes, you can change the light from white to black background, and then it's better for your eyes. But I would prefer a regular book where with pages, and you have to hold the book. And then my own experience is that you read 3-4 pages, and then this what we call the sleep train will come. It's like and then you have to get on the sleep train, because if you're not on the sleep train, it will go 2 hours or so then before it comes again.
Yeah,
It,
that's a
the sleep train is like it's like the hormone in your body is called melatonin, and it's often coming about in the evening at 10 or 11, and then again at 1. So you want to go on the first sleep train, I think.
yes, that's a lovely way of describing that, Karen. I think that's one of the beautiful things with the hearing from different countries. And sort of understanding how the different way you may look at sleep is very similar to us, but you've got lovely different ways to describe it. And our last slide, we're just going to sort of talk about what's happening on our Facebook group. And this is where we really wanted you to sort of share your ideas of getting a good night's sleep, and also that aspect of what are you grateful for today, and that may be some thoughts that you could actually leave with us before you go to sleep, isn't it, Karen, about thinking about what was the best thing about today, to sort of have those nice thoughts as you fall asleep.
Yes, that's very, very nice to maybe pick 1 or 2 things that made the day nice. It could be nice weather. It could be a smile from another person. It could be the love you feel from towards your your sick family member. It could be many things.
Even that's enjoying that lovely walk with your pet, your dog, before you
Yeah.
sort of finish for the day. So yeah, it's a great idea to think about sort of something that you're grateful for the day, and to really prepare yourself for that good night's sleep.
Yeah.
Well, thank you very much for talking with us today, Karen, and we look forward to hearing your other insight on the Facebook group.
Yeah.
Thank you.
See. Thank you.